Many people over 60 ignore the first warning signs of digestive trouble because they seem small: a sour taste after dinner, a pill that suddenly feels hard to swallow, a bowel habit that slowly changes, but the digestive system often whispers before it causes real damage. I'm Dr. Claire Bennett, and today, let's go straight into 7 digestive changes after 60 that you should not ignore. Before we go one by one, I want to give you 3 simple rules. First, do not judge a digestive problem by pain alone. Some of the most important warning signs are not dramatic. They are subtle. You eat less because food no longer tastes right. You stop finishing meals because you feel full too fast. You begin planning your day around the bathroom. That is still your body asking for attention. Second, always review the medication side of the story. After 60, the body can process medicines differently, and the digestive system also plays a role in how medicines move through the body. That means a new digestive symptom may not be just aging. It may be aging plus a medicine, aging plus dehydration, or aging plus a small problem that has been quietly building for months. Third, look for patterns, not one bad day. One heavy meal may give you heartburn. One travel day may make you constipated. That happens. What matters is the pattern. Is it new? Is it happening every week? Is it changing how you eat, sleep, or leave the house? If the answer is yes, it deserves more respect than most people give it. Now let's walk through the 7 changes. 1. Food starts tasting flat and your appetite quietly fades. A lot of older adults think digestion begins in the stomach. It doesn't. It begins in the mouth and nose. If your sense of smell fades, food may taste bland. If your mouth is dry, chewing and swallowing become less comfortable. And when food stops feeling appealing, people often eat less without realizing how much less they are eating. I see this often in older adults who tell me, "I'm eating, doctor. I just don't feel hungry." But when we slow down and look closely, breakfast is toast and tea, lunch is half a bowl of soup, and dinner is a few bites because meat feels too dry or vegetables feel like work. They are technically eating, but not enough protein, calories, or fluids to support strength, bowel regularity, and recovery from illness. This matters more than people think. When appetite drops, the first thing many older adults lose is not just weight, it is reserve. They feel weaker. They get tired earlier. They become more constipated because there is less food bulk and often less fluid. Then digestion seems even worse, so they eat even less. That cycle can sneak up on people. Another problem is dry mouth. Some medicines can cause it, and dry mouth does more than make you sip water at night. It can change taste, make food harder to swallow, and make eating feel like effort instead of comfort. That is when people start choosing only soft, easy foods, which may be low in protein and fiber. And here is one practical detail many families miss. Some older adults have trouble absorbing vitamin B12 from food, and that matters even more if appetite is poor or if they are taking medicine for acid reflux. So when an older adult says, "I just don't care about food anymore," I never dismiss that as normal aging. I want to know what food tastes like, whether the mouth feels dry, whether dentures fit well, whether there is weight loss, and whether medications have changed. What should you do with this change? Start simple. Notice whether food tastes bland, metallic, or just not right. Notice whether you need extra sauce, more water, or unusually soft foods just to finish a meal. Look for unplanned weight loss, weaker legs, more fatigue, or less interest in eating with other people. These are not just kitchen problems, they are health signals. If this sounds familiar, ask for a medication review, a mouth and dental check, and a basic nutrition discussion with your doctor. Sometimes the fix is small, but the impact of ignoring it can be very large. 2. Swallowing no longer feels smooth. This is one of the most commonly minimized problems in older adults. People rarely say, "I think I have a swallowing disorder." They say things like, Pills keep getting stuck. I cough when I drink water. Dry chicken is hard to get down. I have to clear my throat after meals. Or, I just eat slower now. Now, eating slower is not always a problem, but when swallowing starts feeling awkward, effortful, or unreliable, that deserves attention. Dysphagia means difficulty swallowing, and it can make it hard to take in enough calories and fluids. It can also raise the risk of food or liquid going down the wrong way. Older adults often confuse this with dry mouth, eating too fast, or anxiety, and sometimes it is mild at first. A person starts avoiding lettuce, rice, bread, pills, or mixed texture foods like soup with chunks in it. Then they begin choosing only what feels safe. Over time, that narrows the diet and may lead to poor nutrition, dehydration, and fear around meals. What worries me most is not only choking, it is the slow adjustment people make without talking about it. They stop going out for meals. They take forever to finish dinner. They keep water beside them constantly. They cut food into tiny pieces. They avoid meat. They say, "I'm fine, I just have to be careful." But having to be careful at every meal is already a clue that something has changed. You should pay particular attention if swallowing is painful, if you cough during meals, if your voice sounds wet or gurgly after eating, if you feel food sticking in the chest or throat, or if you have had pneumonia, repeated chest infections, or unexplained weight loss. Those are not symptoms to casually watch for 6 months. The practical next step is not to panic. It is to stop pretending it is nothing. Sit upright when eating. Take smaller bites. Avoid rushing. But most important, tell your doctor exactly what is happening. Not, "I have some throat issue." Say, "I cough with liquids," or "pills stick," or "I avoid meat because swallowing feels harder." That level of detail helps. Many swallowing problems can be evaluated and managed. The danger is the quiet delay. 3. Heartburn, regurgitation, or a sour taste keeps returning. A lot of people over 60 say, "I don't really have a digestive problem, I just get a bit of reflux." But recurrent reflux is a digestive change, and it matters. Acid reflux happens when stomach contents come back up into the esophagus. GERD is the more severe or long-lasting pattern when reflux causes repeated symptoms or complications over time. Common symptoms include heartburn and regurgitation. In plain language, that means burning, pressure, or a sour or bitter taste rising after meals or when lying down. This often becomes more noticeable in everyday moments. You bend to tie your shoes after dinner and feel burning in the chest. You recline in the evening and get a sour taste in the throat. You wake up hoarse, coughing, or feeling as though something came up during the night. Some people keep taking over-the-counter remedies without ever asking why the pattern is happening more often. One of the most common mistakes here is blaming only spicy food. Yes, food triggers matter for some people, but meal timing matters too. Large dinners matter. Lying down too soon matters. Body weight may matter. Certain medicines may matter. And some people ignore reflux because the burning is not severe, even though the regurgitation is frequent. After 60, I want people to stop thinking of reflux as a tiny nuisance. Not because every case is dangerous, but because repeated symptoms deserve a real look, especially if this is new, becoming more frequent, or beginning to affect sleep, appetite, voice, or swallowing. A very practical step is this: do not eat and lie down right away. NIGDK specifically notes that eating meals a few hours before you lie down may improve symptoms. That is simple advice, but it helps many people more than they expect. Also pay attention to whether your symptoms are driven by late meals, large portions, alcohol, chocolate, mint, fried foods, or simply the position of your body after eating. And please do not ignore reflux if it is paired with trouble swallowing, vomiting, weight loss, or bleeding. At that point, we are no longer talking about a casual inconvenience. We are talking about a symptom that deserves proper medical attention. 4. You feel full much sooner than you used to. This is a change many people describe poorly, so it gets missed. They do not say, I have early satiety. They say, I can only eat a few bites now. I stay full for hours. Dinner just sits there. I'm hungry in my head, but not in my stomach. That pattern matters. NIDDK lists symptoms of slowed stomach emptying or gastroparesis type symptoms as feeling full soon after starting a meal, feeling full long after eating, nausea, bloating, belching, heartburn, and poor appetite. And importantly, certain medicines can delay stomach emptying or affect gut motility, creating symptoms that look very similar. Now, I am not saying every older adult who gets full quickly has gastroparesis. Not at all. But I am saying that persistent early fullness is not something to shrug off. Why? Because it changes nutrition fast. When you cannot finish meals, you stop getting enough protein. You may also get less fluid, less iron, fewer vitamins, and less overall energy. If you have diabetes, meal timing, and stomach emptying problems can also make blood sugar patterns harder to predict. And if you are taking multiple medicines, an unsettled stomach can make it harder to tolerate them properly. This is especially important in older adults who have diabetes, nerve problems, long-term constipation, or who take medicines that slow the gut, such as narcotic pain medicines, some antidepressants, some anticholinergic medicines, or certain medicines used for overactive bladder. Again, the theme here is not fear, it is pattern recognition. A good example is the older adult who says, I still eat 3 meals a day. But when you ask what those meals really look like, breakfast is half a yogurt, lunch is a few crackers, and dinner is 4 bites before the stomach feels crowded. That person may look stable on the outside, but be slowly undernourishing themselves. So what should you watch for? Feeling full after only a small amount. Still feeling full hours later. Upper belly heaviness. More belching. Nausea after meals. Loss of appetite. Food seeming to sit rather than move along. And what should you do? Try smaller, lighter meals while you arrange follow-up. Keep a simple note of what time you ate, how much you could finish, and how long the fullness lasted. That is much more useful than saying, my stomach's been off. And ask specifically whether any of your medicines might be slowing the gut. That one question changes a lot of conversations. 5. Bloating and gas are showing up more often than they used to. Let me say something reassuring first. Some gas is normal. NIDDK notes that common symptoms include belching, bloating, or distension, and passing gas, especially during or after meals. So the goal is not to become alarmed every time your belly feels a little puffy after dinner. The real question is this: is the gas new, frequent, disruptive, or changing? That is where people after 60 often get stuck. They assume bloating is just part of getting older. Sometimes it is a simple eating pattern issue, but sometimes bloating is a clue that the gut is not moving smoothly, that constipation is building up, that swallowing air has become a habit, or that a bowel disorder is affecting how the intestine handles meals. IBS, for example, often involves abdominal pain linked to bowel movements, plus changes in bowel habits, bloating, and the feeling of not being fully emptied. I hear people describe this in very ordinary ways. My belly is flat in the morning and tight by evening. I burp more than I used to. I avoid seeing friends after lunch because I feel swollen. My clothes fit differently by the end of the day. That is the kind of language I pay attention to. One mistake older adults make is cutting out more and more foods without any plan. First dairy, then bread, then beans, then vegetables, then fruit. Before long, the diet becomes narrow and nutrition suffers, but the bloating is still there because the real issue was constipation, rapid eating, poor denture fit, or an unrecognized bowel problem. Another mistake is ignoring sudden change. NIDDK specifically says gas symptoms deserve medical attention if they bother you, change suddenly, or come with other symptoms such as abdominal pain, constipation, diarrhea, or weight loss, that is an important line. Because I've always been gassy is one story. I'm suddenly bloated every day, and losing weight is a very different story. What helps? Slow down meals, chew well, do not rush conversations while eating. Notice whether symptoms relate more to meal size than to one specific food. Look at the bowel pattern at the same time, because bloating and constipation often travel together. And if bloating is frequent enough to change how you eat, dress, or leave the house, bring it up directly. Do not minimize it because it sounds embarrassing. 6. Constipation becomes a pattern, or you never feel fully empty. This is one of the biggest quality of life issues in older adults, and people still underreport it. Constipation is not just, I skipped a day. NIDK describes it as fewer than 3 bowel movements a week, stools that are hard, dry, or lumpy, stools that are difficult or painful to pass, or the feeling that not all stool has passed. That last part matters because some people move their bowels regularly and still feel constipated because the emptying is incomplete. After 60, constipation can build slowly. Fluid intake drops. Appetite drops. People move less because of pain, weakness, weather, or fear of falling. Some medicines tighten the bowel, and many older adults stop responding to the urge to go because they are busy, tired, or waiting for a better time. Over weeks and months, that becomes a real pattern. What many people do not realize is that constipation can also lead to leakage. Watery stool can seep around hard stool that has been sitting in the rectum. So a person may say, I thought I had diarrhea, when what they really have is constipation with overflow. NIDK explains that constipation can stretch and weaken the rectal area over time, letting softer stool leak around harder stool. That is especially important in frail older adults or people who sit or lie down for long periods. This is why I never let people dismiss stool leakage, staining in underwear, or the feeling of never being done in the bathroom. Those details are medically useful. They help tell the difference between simple constipation, pelvic floor problems, nerve-related problems, and bowel conditions that need more evaluation. Now let's talk about the danger of normalization. Some older adults think constipation is just the price of getting older. It is common, yes, but that is not the same as harmless. NIA and NIDK both point out clear red flags. You should seek medical attention if constipation comes with blood in the stool, bleeding from the rectum, serious abdominal pain, inability to pass gas, vomiting, fever, unexplained weight loss, or lower back pain. And if self-care, such as fiber, fluids, and movement, is not helping, that also deserves follow-up. The practical approach is steady, not extreme. Drink enough fluid for your body and medical situation. Build fiber carefully, not aggressively, if you are already very bloated. Walk if you can. Try to give yourself unhurried toilet time. Review medicines and supplements. And if you depend on laxatives constantly, do not feel ashamed of that, but do discuss it. There may be a better long-term plan than guessing on your own. 7. Your stool, your meal tolerance, or your bathroom pattern starts looking truly different. This last change is where I want you to be especially honest with yourself. Because sometimes what people call digestive changes are actually warning signs. For example, black or tarry stool can be a sign of bleeding in the upper digestive tract. NIDDK lists black or tarry stool, dark or bright red blood mixed with stool, bright red blood and vomit, or vomit that looks like coffee grounds as signs of acute GI bleeding that need medical help right away. Severe bleeding can also cause dizziness, shortness of breath, fainting, or shock. On the other side, pale or clay-colored stools can point to problems in the biliary system, which includes the gallbladder, liver, and pancreas. Medline Plus explains that pale stools may happen when bile is not getting into the stool normally, and they can come with jaundice or dark urine. That is not something to watch casually for weeks. And then there is gallbladder-type pain. NIDDK notes that gallstones can block bile ducts and cause sudden pain, often in the upper right abdomen, and that prompt medical attention may be needed. Many older adults first notice this after richer or fattier meals. They assume the meal simply didn't agree with them. But if the pattern repeats, especially with nausea or right-sided upper abdominal pain, it deserves proper evaluation. This is also where I want to mention unintentional weight loss. If your digestion has changed and your weight is dropping without you trying, that is not a detail to save for your next annual appointment 6 months away. It does not automatically mean something severe, but it moves the whole story into a more serious category. So, what are the bowel and digestion red flags after 60 that should change your timeline? Black or tarry stool, blood mixed with stool, vomiting blood or coffee ground material, pale or clay-colored stool for several days, yellowing of the skin or eyes, dark urine with pale stools, new severe pain in the upper abdomen, especially after meals, persistent vomiting, dizziness or fainting, and ongoing digestive changes with unexplained weight loss. If any of those are present, the question is no longer, should I monitor this? The question becomes, how soon should I be evaluated? Let me close with this. Many digestive changes after 60 are manageable. Some are very treatable. Some come from medications. Some come from slowed motility, reduced appetite, dry mouth, poor sleep, less movement, or habits that gradually changed over the years. The goal is not to become frightened of every symptom. The goal is to stop calling every symptom just aging. If you remember only 3 things from today, let them be these. If food stops tasting right and you quietly begin eating less, pay attention. If swallowing, reflux, fullness, bloating, or constipation becomes a pattern, pay attention. And if you see blood, black stool, pale stool, persistent vomiting, severe pain, or unexplained weight loss, act sooner, not later. Your digestive system does change with age, but the right response is not silence. It is observation, honesty, and timely follow-up. I'm Dr. Claire Bennett. Take good care of yourself and do not ignore the small changes that keep repeating. Those are often the changes that matter most.